Hi everyone. In honor of Movember, a month that is known to raise awareness of men's health, I'm making one new video every Monday to raise awareness about various men's health issues. This is not meant to be medical advice. The goal is to raise awareness about various health issues in hopes to encourage others to have a conversation with their primary care provider. With that being said, let's get on with today's video, which is going to be about mental health. Again, this is going to highlight general information about this condition. This is not going to be comprehensive. If you want further information, I encourage you to speak to your primary care provider, i.e. nurse practitioner or family physician. Why did I choose to speak about mental health issues in men? According to the Center for Addiction and Mental Health, 1 in 5 Canadians experience a mental illness or an addiction problem. They also report that by the age of 40, 1 in 2 people have or had a mental illness. This is a remarkable statistic and just goes to show you how common it is in our society. As a result of its prevalence, I think it is important to speak about this issue and raise awareness about it in hopes to encourage other men to get the help and support they need and not be ashamed to do so. The terms mental illness or addiction refer to a wide range of disorders that affect mood, thinking, and behavior. Examples include depression, anxiety disorders, and schizophrenia, as well as substance use disorders and problem gambling. Mental illness and addiction can be associated with distress and/or impairment of functioning. Symptoms vary from mild to severe, and with appropriate treatment and support, most people can recover. The first disability that I'm going to be talking about is depression. Together, depression and manic depression are known as mood disorders and affect about 10% of the population. Mood disorders cause people to experience more extreme and longer lasting emotional highs and lows than normal. Symptoms of depression include feelings of hopelessness, changes in eating patterns, disturbed sleep, constant fatigue, and an inability to have fun, or even thoughts of suicide. People with manic depression can have these same symptoms plus occasional highs that can cause reckless behaviors. Anxiety disorders. Anxiety disorders can include a number of conditions. Phobias are one type of an anxiety disorder where the person has an unreasonable fear of certain objects, animals, or situations. Another is panic disorders, where the person has repeated and intense episodes of fear combined with physical symptoms such as difficulty breathing. Obsessive compulsive disorder is another type where the person cannot stop a certain repeated action or thought. Most often, the various anxiety disorders are treated with counseling and medication. Just like physical illnesses, mental illnesses can take a wide variety of forms. They affect people in different ways. The good news is that mental illnesses are treatable. So let's talk about some of the treatments for mental illnesses and what are the best ways to receive help. There are many types of therapies that can provide relief. Speak to your primary care provider to identify what's best for you. In this video, I'm going to be talking about cognitive behavioral therapy. So, cognitive behavioral therapy is a practical short-term form of psychotherapy. It helps people to develop skills and strategies for becoming and staying healthy. CBT focuses on here and now on the problems that come up on a day-to-day basis. CBT helps people examine how they make sense of what is happening around them and how these perceptions affect the way they feel. A brief summary of what CBT is like in a practical sense is that it is a structured, time-limited, usually 6 to 20 sessions, and is problem-focused and goal-orientated, teaching strategies and skills that is based on proactive, shared therapeutic relationship between the therapist and the client. Most people know within the first few sessions if they are comfortable with CBT and whether it is meeting their treatment needs. When the fit is not quite right, the therapist may adjust the treatment or suggest other treatment options. In general, CBT may be a good therapy option if you're interested in learning practical skills to manage your day-to-day life and are interested in practicing change strategies between sessions to consolidate improvement. CBT may not be for you if you want to focus exclusively on past issues or if you want supportive counseling. To learn more, there will be resources in the description box down below, so be sure to check those out. Another form of therapies that can be helpful are alternative therapies. Complementary and alternative medicine therapies are natural practices or products that have developed outside conventional medicine. They have three main categories: physical therapies, which are exercising, yoga, being in bright lights, acupuncture; nutraceuticals, which are vitamins, minerals, all that sort of stuff; and herbal remedies, such as St. John's wort, rose root, and saffron. Some of these treatments may work, but most have not been thoroughly tested. Compared to the huge amount of data on standard medication or psychotherapies, research on CAMs are very limited. Few CAMs consistently show positive results, and due to these poor results, it can be difficult to replicate them in the community. Most studies looked at CAMs in major depression, with very few studies in other common mental health disorders such as anxiety, bipolar, schizophrenia. Physical therapies have been far more investigated than nutraceuticals or herbal remedies. Before taking over-the-counter medication, please make sure you speak to your primary care provider about it, as some medications may interact with others. There's a lot more that can be discussed and talked about mental health issues amongst men. Unfortunately, I wanted to keep this video short. And if you would like for me to speak more about mental health issues, let me know in the comments section down below. Be sure to check out the description box for any resources and helpful links that you would like to check out. I've compiled a list of them, and I think they would be beneficial for you to look at. If you enjoyed this video, please consider giving it a thumbs up and let me know in the comments below if you have any other questions. Thank you so much for watching, and I'll see you in the next video.